is a white blood cell that has been invaded, or maybe a red blood cell. Can't tell now. It's too late in the game to tell what kind of human cell it was. This is a Borrelia, a spiral-shaped bacteria that is thought to be the primary cause for what's referred to in the United States as Lyme disease. One of these microbes invaded a perfectly healthy human cell. One of these got into a perfectly healthy human cell, divided and multiplied, made many copies of itself, and then finally ruptured the cell membrane and started releasing those microbes into the environment, so that those spiral-shaped bacteria could corkscrew into another cell and do the same thing again. And so this is the nature of the Borrelia, is to spread this way. It's called the second great imitator. It imitates many different illnesses. If you go to this website, nutrimedics.ec, that's an Ecuadorian internet site, you can look at I think now 380 different illnesses that have been taken from the peer-reviewed medical literature, showing that Borrelia either mimics those illnesses or causes those illnesses. These are some of the illnesses: multiple sclerosis, myelopathy, polyneuropathy, brain tumor, encephalopathy. This is from that journal. Meningitis, encephalitis, neuritis, mania, obsessive compulsive disorder, depression, schizophrenia, anorexia, dementia, from this journal. Also cardiac diseases: cardiomyopathy, congestive heart failure, perimyocarditis, arrhythmias, atrioventricular block, conduction disturbances. This is from this journal. In the United States, an unofficial study was done to look at the incidence of Borrelia in patients with chronic fatigue, and found to be present in 90% of them. It may be less than that for ME, myalgic encephalomyelitis, here in the United Kingdom and in the European Union, but it's very high in the United States. A large percentage of patients with fibromyalgia also have Borrelia as a cause. It can cause Parkinsonism and a variety of other neurological conditions, and also a variety of diseases in children and newborn, and even fetal conditions. So you see those listed there. Oh, that's better. Better? Yes. Okay, good. So these Borrelia that I showed you 2 slides back do not usually act alone. They act in concert with other microbes. So these are called co-infections. Bartonella is a very common co-infection. Probably in at least 30 or 40% of the patients that have Borrelia, there's also Bartonella. The most common Bartonella that we see in the United States is the one that causes cat scratch fever. Okay, but there's 31 or 32 species of Bartonella that are known to be pathological in humans. Babesia, a protozoa very similar to the one that causes malaria, does cause night sweats usually, is very commonly present. This is a microbe described by Dr. Fry in the Fry Laboratory in Phoenix, Arizona. It's a protozoa called Protomyxozoa rheumatica. So it affects the joints, causes inflammation in the joints. Leptospira, some other spiral-shaped bacteria, are very commonly present with the Borrelia. Also the Rickettsia, Ehrlichia, and Coxiella are very commonly present. Also Mycoplasma. Mycoplasma hominis, Mycoplasma incognita fortuitum are most common. And then a variety of other infections either come into the body at the same time as the Borrelia, or they thrive in the body because the immune system is so suppressed because of the Borrelia, because of the Bartonella. This includes a variety of parasites. One recently described in the United States is a small roundworm that lives in the lungs. Larry Klepow described this, and it's a very, very difficult worm parasite to try to eliminate from the lungs. He found that by inhaling pure vodka, that you make the bugs drunk, and then when you cough, they come out. Okay, a variety of fungi. Very commonly when someone goes through treatment for Borrelia, they use this, if the doctor uses standard pharmaceutical antibiotics, it kills off the friendly bacteria that live in the intestine. That causes, where's that coming from? Oh, you're testing another one? This one works better? Is that better? Oh, that's better, yes. Getting better all the time. Okay. So if a patient goes through treatment for these bacteria that I have described with standard pharmaceutical antibiotics, very commonly that kills off the friendly bacteria in the intestine, and the funguses that are in all of us overgrow and become a problem. Candida species are the most common that overgrow in the intestine, but also Aspergillus in the sinuses more commonly than the gut. Penicillium and Cladosporium also in the sinuses more commonly than the gut. Treponema species. Most practitioners don't realize that there's a variety of Treponema species living in the mouth as quote, normal flora. And we're not talking about Treponema pallidum that causes syphilis, but we're talking about other Treponema species. And Dr. Judy McCloskey has now fairly conclusively proven that those other Treponema species in the mouth contribute significantly to dementias, Alzheimer's dementia and other dementias. I'll show that in a few minutes. Now, this microbe was recently described by Dr. Hal Huggins, a doctor of dental surgery in the United States. And there's only 4 articles in the peer-reviewed literature about this bug, so it's not very well known. But he found this microbe, this bacteria, in 14 out of 14 samples of patients that had amyotrophic lateral sclerosis, ALS. Okay, this bug. That's not what we call proving Koch's postulates or Hill's postulates that is a cause and effect relationship, but it's very suspicious that this bug is in every sample that he's tested so far. And viruses. The herpes simplex viruses 1 and 2 that cause the fever blisters on the lips or the genital sores, cytomegalovirus, Epstein-Barr virus, human herpes virus type 6, xenotropic murine leukemic virus associated or related virus, and Coxsackie. And these are just a few. There's many others that sometimes will be present in the body, all adding to the problem of symptoms that the patient suffers. Now, most doctors think that the only way that this Borrelia can be transmitted is through tick bite. But there's a lot of evidence that that's not true. There's a lot of evidence that it can be transmitted by many other routes, including mosquito bites. This is probably the most common route of transmission in Texas, other than human-to-human transmission through sexual intercourse and kissing. Flea bites, as I said, sexual intercourse. Blood transfusions. In the United States, none of the blood is screened for the presence of Borrelia or any of these co-infections before they're administered to the next recipient of the blood. Transplacental transfer from the fetus, into the fetus from the mother. Breastfeeding, drinking unpasteurized milk from an animal that's contaminated, or eating poorly cooked meats. So this article here from Medical Hypothesis in 2003 has articles that are from the peer-reviewed literature that talk about these as sources of Borrelia as an infection. There's 224 peer-reviewed references in that one article. It's a very good article to look at. Most blood tests miss the diagnosis. In that same article, Dr. Harvey and Dr. Salvato tested 455 patients in their practice that had chronic fatigue and a variety of other symptoms. And only 1/3 of them showed up positive on the first test for Borrelia. But during the course of the next year, every patient in that group was positive for Borrelia. 100% of 455 patients. And these are patients in Houston, Texas, where at that time, Borrelia was not considered endemic. A recent laboratory that's started doing testing in the United States that looks very promising for finding the diagnosis is the Advanced Laboratories. They use a very special culturing technique that was developed by Dr. Lida Matman, and they culture the microbes up and then do an immunofluorescent staining for the bugs that they find. This immunofluorescent staining is specific for the Borrelia antigens. And they don't test for any of the co-infections, only for the Borrelia, but it's a good test. In my experience, the standard Western blot and ELISA testing miss the diagnosis at least half of the time. In many cases, as much as 2/3 of the time. There's another laboratory in the United States, in Texas, in Lubbock, Texas, that is now testing for all the co-infections. And so it's very sensitive, ultra-sensitive polymerase chain reaction testing of the DNA of the Borrelia and dozens of other spirochetes and other microbes. And then you'll hear from Dr. Schwarzbach this afternoon about the Infecto Lab here in Germany. Now, this is from the Center for Disease Control in the United States. And you see from this, they say, first we should do, if we suspect Lyme disease, we should first do enzyme immunoassay or immunofluorescent assay. And then if that's positive, then you go ahead with treatment and subsequent titer testing. But if you're negative, what do? They say, consider alternative diagnosis. So alternative is something other than these. The laboratories I just showed you are alternative. The advanced laboratories in the United States, the Infecto Lab may be considered an alternative to what's up here. The laboratory in Lubbock, Texas, the Spirostat. Or electrodermal screening is what I often use, is a way to screen for what's going on with a patient. If I see evidence that a patient has Borrelia or other co-infections by electrodermal screening, then I will say, okay, we'll need to keep looking harder with conventional testing if I want to prove this diagnosis. This is a spirochete, a Borrelia. It comes onto the microscopic slide here in the top left corner and goes all the way across, spiral-shaped bacteria. This bacteria, 2 hours ago, was exposed to a pharmaceutical antibiotic. And that antibiotic caused the Borrelia to start forming these granules. Inside of these granules are enough DNA of the Borrelia to form a new bacteria. Okay? And these granules are completely unresponsive and impervious to pharmaceutical antibiotics. These granules can persist for days, weeks, months, or years inside the body until the antibiotic is stopped. When the antibiotic is stopped, these granules become a spiral-shaped bacteria again. That's the pleomorphic nature of Borrelia. That comes from the Antimicrobial Agents and Chemotherapy, 1995, and from Infection, 1996. This boy is the reason why I became active in Lyme disease. In 2002, his grandmother brought him to a conference that I was giving, and she said, my grandson is very gravely ill with Lyme disease. He's taken the pharmaceutical antibiotics and gotten worse. What do you suggest we do? When she walked up with her grandson, I happened to be standing by the Nutrimatics booth. And I said, I'm not sure, but they have a herb here that's supposed to be very broad spectrum antimicrobial called Cemento. I said, let's energetically test it on your grandson. So we did that right there at that moment. And energetically, it tested very good using muscle testing. So I thought, it looks like this would work. And when I tested the doxycycline that they brought with him, which he had been on most recently, it tested very poorly. So I said I would go back to the Lyme literate physician and get his permission to stop the doxycycline and start instead the Cemento and see how he does. The grandmother took her grandson to his house and she went to her house. And I later learned that without asking his parents or her or the doctor or me, the boy started on Cemento and stopped the doxycycline on his own. And 2 weeks later, he was very much improved. And 2 months later, he was completely well. Even though he had gone from being an A student to an F student with the illness, he came back up to being an A student in less than 2 months. He became bedridden during the illness, and within 2 months, he was back to doing sports. So this boy got my attention. And I said, that's amazing. And so I started learning more about Lyme disease and seeing how widespread a problem it was in Texas, where this study was done that we did. And the more I learned about this illness, the more compassion I developed for the patients that had this illness, because oftentimes they were told, there's nothing wrong with you, you're crazy, you're sick in the head, your tests are negative, we need to put you on a psychotropic drug medication to take care of your problem. There's nothing wrong with you, go home. So anyway, when the grandmother whose grandson she had brought learned how much improvement he had, she talked to the Lyme literate physician who was treating the boy. And he said, it's not possible that the Cemento had that effect on your grandson. There's nothing stronger than the pharmaceutical antibiotics that I already gave him to get rid of the Lyme disease. She said, no, pretty sure that the Cemento is what did it. He said, I'll prove it. I'll send you patients that have failed antibiotic therapy, and you can put them on the stupid herb and see that it does not work. Okay? And so he referred 58 patients who had failed antibiotic therapy. And over 3 months' time, there was a 25 to 50% improvement in all of those patients. Now, they weren't getting just Cemento. They were getting Cemento plus drainage herbals and drainage homeopathics and a change in diet and more water to drink and all these things. So you can't blame it only on Cemento. And she didn't try to do that. She just said, we can help these patients. So she called me up excited and she said, I want to do a clinical research study, a control study. I said, I don't have time to do research. I'm a clinician. She said, but I don't know anybody else to help me. And so I said, okay, as long as you'll do all the work, I'll show up every other week to evaluate the patients. And so she started the study in Dallas in 2003. The question to be answered, can integrative natural medicine make a difference in advanced Lyme borreliosis patients given no hope by conventional medical doctors? The question is not, can we find one magic bullet to get rid of Lyme disease? The question is this, can we make a difference? So you'll see, we didn't use a single modality. We did a lot of evaluations, we did a lot of treatments. We did a physical exam on every patient every 2 weeks. We did a medical outcome short form questionnaire that was validated in the peer-reviewed literature. We did symptom severity questionnaire. We checked the bioterrain, the pH of the saliva and urine, and the mineral conductants in the urine and saliva, or just in the urine. We did dark field microscopy. That was very fascinating. On the first specimen that we got from the patients that were being treated, there was spiral-shaped bacteria swarming the slide, thousands on every field. On the next time, 2 weeks later, there was a few. 2 weeks later, there was none. And we thought, wow, that's pretty fast. But the patients were still symptomatic. So we crushed the red blood cells and looked again and found a lot of bacteria that were inside the red blood cells that were released when we crushed the red blood cells. So 2 weeks after that, we crushed the red blood cells and there's almost none inside the red blood cells either. 2 weeks after that, there was none, period. So we saw the progressive reduction of the load of the microbes in the body. We did energetic evaluation on every patient, every visit. We did cell blood count, chemistry profile, Western blot on the first and last visit. So these are the therapies. Again, we're not looking for a single therapy. We're trying to find out is anything collectively capable of helping these patients given no hope. So we changed their diet. How many of you are familiar with blood type diet? Yeah, okay, good. Now, on the surface of red blood cells are lectins that will cross-react with lectins on the surface of foods. And so if you eat the foods that are wrong for your blood type, you get sticky red blood cells. They stick together and you don't get good transport of oxygen into the tissues. So this is not a good thing for a patient that's chronically infected. Also, we know that a person is much more likely to develop an allergy to a food if they eat a food that's wrong for their blood type than if they eat a food that's correct for their blood type. So we put every patient on a blood type diet, a diet appropriate for their blood type. We gave them enzymes with meals and enzymes in between meals, multivitamins, minerals, herbs to detoxify and support all organs, homeopathics to support their body. The Cemento was the only antimicrobial in the first study that we did. And then we did something to detoxify them, to drain their lymphatic system, something to help detoxify them through their skin, stretching their muscles and joints, encouraging them to laugh, encouraging them to get quiet and still and meditate and pray, and to release any emotions that they could. Now, we did this last part because if we got attacked by the authorities in the United States, we could always say, well, God must have done it. Okay? It wasn't our fault. Everybody was praying. Okay. Anyway, the most common adverse reaction that the patients experienced in the study, and still to this day the only significant adverse reaction that the patients experienced from the Cowden support program, is the Herxheimer reaction. The Herxheimer reaction is when you kill off too many microbes too fast. The carcasses of the dead microbes pile up in the tissues and create a stench in the tissues, create a poisoning in the tissues, and the patients become symptomatic with headaches, nausea, vomiting, muscle aches, joint aches, and a variety of other symptoms. And so that was the reason why all of those drainage remedies, the herbal and homeopathic drainage remedies, were so important, and drinking enough water was so important. Now, we learned during that study that if a patient developed a Herxheimer reaction, you needed to give them drainage remedies every 10 minutes until the Herx reaction went away. Sometimes that took an hour, sometimes that took 2 hours, sometimes it took 3 hours. But in most cases, the Herxheimer reaction would not persist for days like it does when you take standard pharmaceutical antibiotics. It would go away within a few hours. So the patients were willing to continue the therapy because they saw that there was a way to deal with the Herx reaction if they got it again. That's one of the problems in a lot of studies, is that the patients are not compliant because they get discouraged. They feel so terrible, they say, I'd rather die than take the therapy. Okay, so the other reactions are very rare except for the Herx reaction. Now these are the symptoms that were present in the patients that we treated. In this study that we did, we had initially 14 paired patients. In other words, 28 patients total that were paired. Each patient was paired with someone that was the same sex, the same age approximately, the same blood type, the same smoking history, the same degree of illness, the same as as many different things as we could think of that were paired. So in that initial group of 14, on the very first evaluation of that group that was going to go into the treatment protocol with natural therapies, we found one of those patients had a tumor in the ovary. So we referred her to surgery. The surgery showed that it was an ovarian cancer, so she fell out of the study. The other 13 patients that were in the treatment group with natural therapies finished the study. So this is the reporting from those 13 patients. All of them had fatigue. That's the most common symptom. A lot of them had stomach pain, joint pain, memory problems, muscle pain, visual disturbances, emotional instability, anger, frustration, sadness, depression were the most common. And then peripheral neuropathy, pins and needles sensation in their arms and legs. Insomnia was fairly common also. At 10 weeks into the study, 2.5 months into the study, there was a significant number had improved. This is the percentage over here. So 92% of the patients had improved with fatigue. you see that it's anywhere from 75 to 100% improvement in each of these symptoms by the 10th week of the study. Now, if the patients were asked, what is the degree of improvement that you've experienced at 10 weeks, on average, they said about a 70% improvement in my symptoms. Now that's significant, because in order for a patient to acknowledge with their lips that they have improved, we know from research that was done in about 30 years ago that you have to have at least a 70% improvement in the patient. Okay, so we know that they had at least 70% because of previous research. Now this is the evaluation by the doctor. The doctor that referred the 28 patients for the study evaluated all of them on a regular basis. He was continuing to treat the control group with the best allopathic drugs, therapy that he knew to give them. And he was biased actually against the effectiveness of the therapy. So these results, if anything, were biased in his favor, not in favor of the natural treatment group. So he said that in his control group, that 1 patient improved moderately. 6 patients improved slightly, 4 patients were not changed, and 3 patients worsened in the control group. In the experimental treatment group, in the patients that got natural therapies, 6 of the patients, 46%, improved significantly, greater than 75%. 38% improved markedly, between 50% and 75% improvement, and 25% to 50% improvement, moderate improvement in 15%. None of them improved slightly. None of them in our natural treatment group had no change, and none of them worsened. Okay, so you don't have to have statistics to see that is a fairly drastic change between the 2 groups. And by the way, when we looked at the symptoms on the control group, the patients basically had the same opinion of their own condition as the doctor. We talked to the 1 patient that he said had improved moderately. She said, well, maybe slightly. So, okay, so at 10 weeks, that's the summary. In the control group, very little improvement. In the integrative treatment group, the natural treatment group, all 13 improved subjectively and objectively, 2 of them moderately, and 11 of them markedly or significantly. By the 18th week, the patients in our alternative treatment group said that they experienced about a 90% improvement overall of all their symptoms. Just 2 case presentations out of that group. This first young man was about 40 years old when he 38 to 40 years old when he came into the study. He was, 35 years old, sorry. And he was 100% disabled. He had lost from 155 pounds of body weight, which is about 70 kilos, down to 98 pounds of body weight, which is about, what is that, 45 to 50 kilos. So he was very emaciated. He looked like a prisoner of war. Because the Borrelia had affected mostly his gastrointestinal tract. He had been to see 50 different specialists, including 2 trips to the Mayo Clinic. The Mayo Clinic in the United States is considered the mecca for medical diagnosis. All of those doctors said, there is no help for you, there is no hope for you. So after treatment, the insomnia was completely overcome. The joint pain was 50% improved. His energy was 90% improved, and he had renewed hope for the future. And his family could see that he had improved. Over the next year, this young man continued the therapy that was done during the treatment protocol with some additional modifications as they became available. And after 1 year, he moved from Dallas to northwestern Arizona, bought a piece of property, built a house completely by himself with his own hands. Okay, studied to become a naturopathic doctor, and now is treating patients in northwestern Arizona, and is fully recovered, and hasn't been on any kind of therapy for Lyme disease now for 10 years, something like that. Okay, so there is hope. Yeah. This is another girl that was in the study. She was 17 years old when she came into the study, became 18 the month after the study started. And she was completely dependent on her family. She was able to only walk with a walker. She had been sick since she was 3 years old. She had been sick for 15 out of 18 years of life. No social life. After treatment, she was able to take care of herself, walk without a walker, go out on dates, and 50 to 75% improvement in symptoms in that 18-week period. The doctors that were taking care of this girl said that she would never go to college, she would never marry, she would never have children. Okay, she went off to college within 1 year of the time within 9 months of the time the study started. She put herself through college, worked her way through college, and finished college in 3.5 years with honors. Okay, she worked on her master's degree, finished that. Now she's working on her PhD. She has married, and she's quite capable of having children. And she's very healthy. Okay, so after the study was formally over, after 18 weeks, it was obvious to me that we'd made a dent in this condition, but we hadn't cured every patient. So the patients who were willing to continue following along with me at the office came to my office, and I would evaluate them, and I would try to withdraw therapies that they were on to see if that therapy was important or necessary. If they got worse, I said, that one's probably necessary. If they did not change, I said that was probably not necessary. So over that time, I was able to eliminate some of the therapies that we were using during the program. The white ones were not essential in every patient. So not every patient had to have enzymes with the meals, but I did find that every patient had to have enzymes in between meals. Some patients did not have to have vitamins if they were eating a really good diet. But if they didn't eat a very good diet, they needed vitamins. Some patients didn't need the homeopathics if they were taking the quantum physically imprinted berber from Nutrimetics. During the study we didn't have berber, but right after the study, Nutrimetics developed the berber. Berber is a desmodium species, a shrub that grows in Peru. It's been used for hundreds of years for detoxification, and it's been quantum physically imprinted with the energies that help to detoxify the liver, the gallbladder, the kidneys, the lymphatics, and the ground matrix. So it's a multi-detox herbal. Shortly after that, they developed the parsley detox, which had the same capability. Now they have the trace mineral relax detox, which does the same thing. We found that the patients, some of the patients benefited from glutathione, some did not. So we changed that from essential in everyone to non-essential in everyone. This is a device that helps to get the lymphatic system going. What I found is that if a patient was able to lie on their back on the bed and put their legs up in the air and do the motion like they're pedaling a pretend bicycle in the air, that they did not need the chi machine or the light beam generator or the dry skin brushing or the other lymphatic help. So that was a very simple thing for them to do. We found that if patients had emotional issues and didn't do anything about it, they remained ill. But if they did some work to try to resolve the subconscious toxic emotions, they got better much faster. If they didn't drink enough water, they didn't get well, no matter what. And a lot of people drank coffee and sodas and called that water. It doesn't work. Those are not detoxifying. And also we found out if they didn't do something to try to bind metals, that they did not get better, because what I observed is that as you kill the microbes, the metal levels actually go up in the body, in the 24-hour urine collection. And what I recognized or believed was that the microbes had taken up, most likely had taken up into their bodies some of the metals and released those metals back into the human body when they died. So I modified the program over the next couple of years, and I got a call in the end of 2006, about 3 years later, from Dr. Horowitz in New York. Dr. Horowitz was the president of the International Lyme-Associated Disease Society and had, at that time, 10,000 patients with Lyme disease in his practice. And he said, I have 500 patients that are not doing well on antibiotics. Do you have any suggestion? I would like to offer something to help these patients. And I said, are you willing to use herbals? He said, yes, I am. I said, do you know energy medicine? He says, no. I said, are you willing to learn energy medicine? He said, no. And I said, well, why is that? He said, well, some doctors in New York who've used energy medicine have lost their licenses. I said, that's a good reason. He said, can you design me an empiric protocol that I can use that will help most patients so that I don't have to try to do energy medicine? I'm fearful of doing energy medicine. I said, okay, I'll develop empiric protocol. So that's what I did for him. And he started several hundred patients on that protocol. And I think in the fall of that year, he presented his results to the International Lyme-Associated Disease Conference as in the fall of 2007. And you can see that protocol on that website, nutrimedics.ec, as it's been modified a little bit since then. Now, so I think he reported on 70 some odd patients at that fall meeting that year, but after that he did quite a few more. But 70% of those patients improved fairly quickly when they were on that herbal protocol, even though they had completely failed pharmaceutical antibiotic therapy. Yeah, there he presented that. So when he called me and told me he had a 70% success rate, I said, well, that means you have a 30% failure rate. He says, well, I didn't look at it that way. I says, well, what are you going to do about the 30%? He said, I don't know. I said, well, I will come to your office and we will evaluate some of the patients in the 30% and see if we can help some of them. So I did that. And we found that they were not drinking enough water, was the most common problem. Most of them had mercury fillings in their teeth, which they'd done nothing about. And that was a challenge, a problem. And a few other things. So as a result of that evaluation, I modified the protocol, and he put another several hundred patients on the new protocol, and he found that 85% of the patients improved fairly significantly with the new empiric herbal protocol, which is what Nutrimedics offers now. So in summary, the Lyme protocol is first 3 days taking berber, which is a detoxification herbal, or parsley, which is another detoxification herbal, or the trace mineral relax detox, which I didn't put up there, but it's another choice that the Nutrimedics has. And it's a very good choice because the patients usually don't develop an allergy to that because there's no phenolics in it. Okay, so it's a mineral product that's been quantum physically imprinted. So it's called Trace Mineral Detox Relax. I think I have that on another slide. Pinella is a product that's been used in Peru for several hundred years also to detoxify the body, but mostly detoxify the brain and the spine and the nerves. So they take only those detox products for the first 3 days. On the 4th day, they add several things. Serrapeptase. Now, serrapeptase is a proteolytic enzyme that they take 30 minutes before food with water to digest the fibrin that's inside the body, covering over microbes. So when the body is exposed to microbes, it causes the body to produce fibrin. Fibrin will cover over the microbe, trying to wall off the microbe from harming the body. But in doing so, the fibrin hides the microbe from the immune system. So this fibrin-covered microbe looks like self. When the serrapeptase strips the fibrin off, then the immune system can see the microbe and remove and destroy the microbe. In addition, the fibrin will coat the inside of the wall of the blood vessel. So if this is a capillary and fibrin is coating the inside wall, the oxygen inside the red blood cells cannot go through the wall of the capillary into the tissues very efficiently. It will sometimes decrease the oxygen transport time from 5 seconds to 5 minutes, 60-fold prolongation of the transport time of oxygen into the tissues. We also, on the 4th day, add magnesium malate. Essentially, every patient that we evaluated in the Lyme study, as well as the subsequent follow-up, before Dr. Horowitz started his treatment of his several hundred patients, had magnesium deficiency. Without magnesium, you cannot produce energy, ATP energy for the cell. So magnesium is required for 50% of the metabolic enzymes. Also, if you're deficient in magnesium, you can't get proper nerve conduction, muscle contraction. Many other things are not working if magnesium is not present. Magnesium is wasted through the kidneys into the toilet in any patient that's under stress. That doesn't matter. It doesn't matter whether it's emotional stress or microbiological stress or chemical stress or electromagnetic stress. Any stress will waste magnesium through the kidneys into the toilet. And so in order to replenish that, you must be taking magnesium orally or intravenously or intramuscularly. The Banderol is started on the 4th day at 1 drop. The Cemento is started on the 1st day at 1 drop. And the Sparga is started on the 4th day. Now the Sparga is an asparagus extract that has the quantum physical imprint of the sulfa antibiotics and the other sulfa drugs, the sulfa diuretic medications and the sulfa diabetic medications. The reason we found out that is important is because about 30% of the population that's chronically ill have the inability to properly process sulfur drugs. And so those sulfur-containing drugs build up in the tissues and block the body's ability to produce glutathione and therefore to detoxify other toxins from the body. So if sulfa drugs are present in the body, either from having ingested them or from having gotten the sulfa drug in through the shower water or the bath water, which is the most common way that people get it in the United States, the sulfa drug that's in the body will block the body's ability to detoxify. On the 4th day, we also added the zeolite plain. Now, the zeolite plain is a volcanic clay that that is bubbled up through water and has the quantum physical imprints of only a few heavy metals, of lead, of aluminum, of nickel, yeah, and cadmium. I think those are the 4. But if you start moving some of the heavy metals out by a homeopathic type effect, then the patients can start getting unloaded a little bit and actually start doing better. On the 49th day of the treatment program, the patient is switched from zeolite plain to zeolite HP. Chemically, the two are identical. Quantum physically, they're very different because the zeolite HP has the quantum physical imprints of all those heavy metals I just mentioned, plus mercury and arsenic and antimony and some of the radioactive substances and so on. On the 78th day of the protocol, the patient's been on the full dose Banderol and the full dose Cemento for that period of time. The reason that those two are given is because the Banderol will help to eliminate the funguses that have built up in the gut and in the sinuses of the patients that have been on pharmaceutical antibiotics before. And the Cemento helps to modulate the immune system. So instead of giving a very strong, positive immune boosting reaction from the Banderol, if you give Cemento with that, the immune system is modulated so that it's not overactive, so you don't go into as much of an autoimmune or hyperreactive immune state. But on the 78th day, this Mora, which is a combination of herbals for helping to get rid of some of the Babesia and some of the other microbes, is added, alternating with Inula. Also on the 78th day, these start rotating, cycling Cemento to Commanda to Hatunia. This is something important to point out here. I found out in the 3 years between the first Lyme study in Dallas and when Dr. Horowitz started his study, that if the patients were given the antimicrobial herbs continuously, they got better for a time. As soon as you stopped the herbs, they got worse again. But if you gave the patients a cyclical therapy where they were taking the antimicrobial herbals for 12 and a half days on, and then 36 hours off, and then 12 and a half days on, and then 36 hours off, and then 12 and a half days on a continuous basis, on a non-continuous basis like that, the patients would have, when you finally stopped the antibiotics, the patients would stay well. And what I concluded from that is that during the 36-hour period that the antimicrobials are not being given, the granular form, the L form, the cyst form, the spore form, all the different forms of the Borrelia would transform back into the spirochetal form. The spirochetal form is very vulnerable to treatment, either from herbals or from antibiotics. And so the staying off for 36 hours was very important so that the bugs would come out of hiding and start playing again, start invading cells or trying to. And then when they were least expecting it, we'd hit them again with antimicrobial herbals. And so by doing a cyclical therapy like that, the load of microbes was progressively decreased. Yes, ma'am?
Can I just clarify? So you build up 1 drop to 30 drops of Banderol.
Yes.
Then when you switch from Banderol to Mora, you do 60 drops.
No. When you go to, this is Banderol, 30 drops twice per day.
That's twice per day.
Yeah, and this is all these are 30 drops twice per day, so it's 60 drops per day.
But you start with 1 drop?
Start with 1 drop twice a day, yeah, and you build up to 30 drops twice a day. Yeah. And the same thing for Cemento and the same, but those two are built up. The Cemento and the Banderol are built up to try to minimize the Herxheimer reaction. So you don't just jump on to 30 drops twice a day the first day, otherwise the patients have a terrible experience and don't really want to go back on the protocol again. But once you've built up on those two, I've found that in most cases the patients can actually switch from full dose Banderol to full dose Commando without building up on Commando, or full dose Banderol to full dose Hatunia without building up on Hatunia, and so on. Any other questions on that? Yes, ma'am.
Not correctly, but you've used the terminology a number of times that I'm not familiar with. You've been talking about quantum physical imprint
Yes.
quite a bit, and I'd like to know what that means.
Okay, I could tell you how the quantum physical imprinting process is done, but I'd have to kill you. That's a joke. Okay, the company has a Russian researcher who's developed a technique to actually put into the liquid herbals the energies that represent the homeopathic equivalent. Okay, so these herbals work herbally and chemically, like you would expect, but they also work like a homeopathic at the same time. Okay? These, I can't tell. I think those are fluorescent lights up there, but I can't be sure. But if that's a fluorescent light up there in that long string there, that is a plasma tube. Okay? When you excite gases inside of a plasma tube, it emits an energy. If the electricity that's going into the end of the plasma tube is pulsed rather than continuous, then whatever the pulsing rate is comes into the liquid media that's right outside that tube. Okay, so I can tell you that much without killing you. Okay? But you wouldn't do it with neon. It's a bad choice. You need different types of gases. Okay, so the basic, one second. The basic program is 190 days, and that is, you can do a printout from nutrimedics.ec for that 190-day dose-by-dose regimen. But most patients make the mistake of not also printing out the 2-page summary. On the 2-page summary it says, if you get Herxheimer reaction, do this. If you get anxiety, do this. If you get depression, do this. If you get insomnia, do this. And so they call up oftentimes to the Nutrimedics office and say, I got one of these things, what do I do? Did you read the summary? What summary? So make sure that every patient that's going to get the program gets the summary also, and reads the summary, and understands what to do that talks about in the summary. You had a question?
Yes, and do I understand well that from day 78 onwards, you combine Samento and Banderol, you combine Mora and Humanda,
Yeah.
and after that, and you combine Annula and Utinia after that.
Yeah, so what we're doing in the days after the 78th day is 12 and a half days on one pair of antimicrobials, off 36 hours, on 12 and a half days of a different pair of antimicrobials, off 36 hours, on 12 and a half days of a third pair of antimicrobials, off 36 hours, and then 12 and a half days back onto the first pair, and keep that rotational process going up. Actually, in most cases, you can actually just use 2 different pairs alternating back and forth. Works well. What I've found, though, is that there's enough different species of these Borrelia and co-infections that it's very good to have a variety of antimicrobials, because you'll have a better chance of getting rid of whatever special bug that person has. Maybe they have a leptospira that you need to try to get rid of, and you don't, if you just used one pair of drugs, one pair of herbs, you wouldn't get it. Okay, so this is our break point. But you can see, there's the same thing over there on the side. But these are the products that are used during that 6-month program. Now, the first time we did this, how many bottles were there altogether? 17. So it used to be 17, now it's down to 14. It used to be 7 dosings per day, 8 dosings per day. Now it's down to 4 dosings per day. So the program is still not terribly simple for someone to follow, but it's much more simple than it used to be before we modified it. But if the patient has that 190-day, this one, 190-day printout from nutrimedics.ec, they know exactly what to take, exactly what time of the day, every day. So they look at the sheet, take what it says, check mark that they took it. Then later in the day, see what they're supposed to take it out, take it, check mark it. So if they'll do it that way, usually they don't miss doses and they have a great success.